Welcome to the Ortho on the Go podcast. My name is Chuck Dowell, host of the podcast. This is an educational orthopedic podcast focused on discussing both clinical and functional orthopedics. We will discuss a variety of topics within the field of orthopedics, including reviewing interesting cases, hearing from different professionals throughout the orthopedic profession, and discussing common musculoskeletal injuries and complaints. This podcast is meant for anyone that wants a better understanding of orthopedics, including all levels of practitioners, coaches, parents, and athletes themselves. My name is Chuck Dowell. I'm one of the physician assistants here at Colorado Springs Orthopedic Group in the Express Care. Today I have the pleasure of speaking with Darin Yantis, the physical therapy supervisor for both the North and East location, right?
Correct.
All right. So we thought it'd be good to do an episode regarding pickleball injuries. We know that pickleball is one of the fastest growing sports in the U.S. There's an estimated 5 million people participating in pickleball. And then as the sport has grown, we've seen a lot of injuries. I know I personally have seen a lot of injuries in the Express Care clinic. I'm
Seen a lot. Various sprains, strains, ligaments, and everything in between.
Yeah, so that's the good thing. I think with a lot of the pickleball injuries, they're mostly low-level injuries, as Darin said, mostly sprains and strains. I have seen some fractures from some falls, some concussions, and that type of stuff. Because it's growing and because we're seeing more of these injuries, we thought it would be good to do an episode regarding possibly injury prevention, mentioning some of the injuries that we commonly see, and then Darin's going to give us some exercises to do for injury prevention and also some warm-up exercises to do to help reduce the risk of injury, right?
Correct. Perfect.
So you mentioned already, what are some of the common things? So you said sprains and strains, like what body parts do you most commonly see affected?
Lately, we've been seeing a lot of hip injuries.
Okay.
So anything from glute med to a bursitis on the lateral hip. So it's typically kind of a pain out towards the edge of the hip.
Got it.
I've also seen some Achilles injuries.
Yep.
More of kind of a tightness, a tendonitis type of issue, probably due to lack of adequate warm-up.
Yeah, I think that's one of the big things. So as he was mentioning, I think some of the literature shows that, a majority of the people participating in pickleball are over the age of 50, and we think 25+% are over the age of 65. And one of the recent literatures or studies that came out show that 80% of the injuries from pickleball are lower extremity injuries. So as you mentioned, I think in the Express Care clinic, what we often see, as he mentioned, are sprains and strains of the hip. I see a lot of aggravation of underlying knee arthritis. And then as you mentioned, a lot of calf injuries, gastroc injuries, Achilles tendonitis, Achilles injuries. And then I do see a lot of shoulder injuries, underlying rotator cuff pathology that becomes symptomatic secondary to the pickleball, and even some lateral epicondylitis, similar to tennis type stuff.
Yeah, been seeing a few of those lately also.
What do you think, I guess, in your thought process is the reason for possibly the injuries that you commonly see?
I'd say people go from no activity, jump right into it, thinking, hey, everyone's doing this, let's try, without adequately warming up the tissues, prepping them for any kind of strain or load. So some kind of dynamic warm-up is going to reduce the injury risk.
Yeah, and I think, as he said, I agree with that. That's what a lot of the studies see. And, pickleball is nice, and I think it's so popular because it's an easy sport to play. The rules are pretty simple. It's a small court. You can play it as doubles, and you can almost kind of, be a sedentary person. And as you said, your buddy says, hey, I'm going to go play. And there's a lot of courts available throughout our area and throughout the country as well that are free to play on, and you can just go out there and play. And a lot of the times, if you go from the sedentary position to an active dynamic sport, these common soft tissue injuries can happen. As we talked about, Darin's going to help to show us and talk through some of the common exercises. So I think there's two components to it. There's the strength component to it for injury prevention, so exercises that people can do to help maybe get them strong so they could participate in pickleball and maybe be better at it. And then there's the dynamic warm-up or the functional warm-up. What are some of the exercises they can do from a strength perspective, like an injury prevention perspective?
So I'd say with these exercises, something you can do at home a couple times a week to kind of prep the body for going and doing an activity like pickleball.
Mm-hmm.
A lot of hip strengthening stuff. We'll kind of go over those with the TheraBand here in just a minute. Again, something you could do at home, not necessarily at the court. Some equipment required, so we'll kind of go over those here in a minute.
Yeah, I know a lot of the times when I didn't have stuff to do at home, I would just lift gallons of milk, or, I would lift, jugs that weighed 5 pounds just to use as that resistive weight if necessary. And if you have stairs at home, you could do something as simple as kind of going up and down the stairs just with correct form and position.
Definitely. Body weight makes it easy to work on strength. You just put in the correct position. You can use the body weight and gravity to work on a lot of strength aspect.
Yeah. And I think the biggest thing is that with pickleball, because it's a dynamic sport, it's such a cutting and pivoting sport, you want your body to have some acclimation to being able to do those activities. And so maybe if you play pickleball once or twice a week doing some of these simple body weight exercises just so your body is ready for those dynamic activities, and that will help significantly reduce possible injuries.
100%, definitely.
It's so, as we mentioned, a lot of the injuries we see are commonly sprains and strains, which is nice. From a treatment perspective, let's say somebody is playing pickleball and they have an injury. What is your recommendation as far as when to be seen? Because we're all stubborn patients. I'm as stubborn as anybody else. I don't like to go in and be seen, and nobody likes to come in and see us. But from your perspective, if like a friend calls and says, hey, I hurt myself a couple of days ago, what would you tell them as advice? Hey, should I come be seen by a physical therapist? Should I come to the Express Care Clinic and get x-rays or be checked out?
So a couple things kind of lead into that. I'd say something that's more of a 6 out of 10 pain or greater is something I'd say go in and get checked out for in the Express Care.
Yeah.
If it's that high level of a pain, there might be some kind of deeper trauma to the tissue that maybe you need to go get checked out right away.
Okay.
Otherwise, from a rehab perspective, I like to let that acute phase settle just a little bit. A lot of times you might tweak something, and your body naturally just takes care of it. A little bit of rest a day. Sometimes the next day you wake up, I feel better.
Yep.
So I'd say outside of that acute phase, maybe 5 days to a week after injury. If it's still there, then maybe it's worth coming in, getting looked at, see if it's something that might need some further looking at. Maybe a visit over to Express Care or MRI, X-ray, something like that.
Yeah.
But a lot of stuff will subside if you give it a day or two.
Yeah. And I think that's the same advice I give a lot of patients that come in or friends that call me. I think, the acute inflammatory phase in the body is typically, 2 to 3 days. So we know that kind of you injure yourself on Sunday, Monday, you're not too bad. Tuesday, Wednesday, you're pretty painful. In my advice, if it lasts for more than 3 to 5 days, I typically recommend you come in and get evaluated. As you said, I think if you have pain with weight bearing, if you have pain more than a 6 out of 10, it's not improving with anti-inflammatory medications, ice, and rest, then I think it's worth coming in to get evaluated just to make sure that it's not something more complicated like we've mentioned, a possible fracture somewhere from a sprained ankle or a fall on an outstretched arm and maybe a wrist injury. So I think from that perspective, that's when I would advise somebody to come in and get looked at. We talked about the exercise perspective. What if a patient says, hey, I'm not super familiar with exercises. I can read what you wrote or I could see the videos that you're going to show regarding the exercises, but what if I want some more one-on-one attention for that? I think we talked about this before. What I like to do is I send patients just for 1 or 2 physical therapy visits. And I think you guys can show them the appropriate form and the appropriate exercise to do, and then they can kind of take it over and do it on their own.
Definitely. I like one visit initially to kind of get a routine down, let them work on it for maybe a week, 2 weeks.
Yep.
And then one follow-up just to make sure they're doing them correctly.
Yeah.
If we're doing them incorrectly at home, then it could even cause more damage than good.
Yep.
So a second follow-up just to make sure they're doing a thing appropriately. Maybe they need progressed a little bit if some of them are too easy. Just a second follow-up to kind of go over that.
Perfect.
So 1 to 2 visits just to kind of work on a home exercise program.
So
adequate.
If somebody wanted to do that, they wanted to come in and work with you guys, how would they do that? Do they need an order from us to do it? Can they come in and just, call the office and get in for a screening visit?
It really depends on insurance.
Yeah.
But unfortunately,
yeah.
But they can get a referral sent over from their primary care provider. They can come see you.
Yep.
You can put in a referral. They can see one of the docs upstairs and they can send down a referral. And then we can get them in that way for an eval and then one follow-up visit.
Perfect. Yeah, and so that's one of the benefits of the Express Care is it's a walk-in clinic, and so you can walk in if you're having an injury that you think exceeds the level of kind of what you can tolerate, or as we talked about, lasts for more than a few days, or a pain level of 6 out of 10. We can evaluate you, we can do x-rays, and then, if we think it's something that physical therapy would benefit from, we can send them to see you and we can put the referral in. So that's, I think, very helpful for patients. And the last thing we mentioned, which I think is quite helpful, is the warm-up. So
100%.
I'm just as guilty as everybody else. We exercise together, and we've been, to the gym together. I walk in, I put my shoes on, and I go exercise. And I know that I'm a terrible patient because of that, but that's just, we're all terrible patients, I think. So from your perspective, how important is the warm-up, and what type of warm-up would you recommend for somebody that's going to go play pickleball?
So warm up really is the key. Like Chuck said, I used to go in, just grab a bar and start lifting.
Yeah.
Now I've gotten older.
Yeah.
Warm up is 100% the key.
Yeah.
So I like to say a warm up, do something that's going to imitate what you're going to be doing.
I like it.
So, we'll go over some stuff from ankles all the way up to shoulders, just to get those tissues warmed up, ready to play.
Yeah.
And it could be anywhere from 5 minutes, 10 minutes if you really want to warm up, various body parts, but it doesn't have to be long, it doesn't have to be extensive.
Yeah.
Just something fairly quick to at least get the tissues ready.
Yeah, and I think, as you mentioned, as I've gotten older as well, I think more of these aches and pains tend to happen quite a bit. I've noticed that my body needs more of a warm-up to be able to participate in these sports and reduce the risk of injury. As we mentioned, we know that majority of the patients that are playing pickleball are over the age of 50 and 25% over the age of 65. So I think that warm-up's important. It's important to show up 10 minutes earlier and just kind of do that functional specific warm-up, that activity specific warm-up, just to kind of get the blood flowing, and that'll significantly help reduce a lot of these sprain strain risks.
A lot of the courts are crowded now too, so getting there, waiting for your court to open up,
correct,
start your warm-up stuff.
Yeah. And that's another thing. I think sometimes, you can warm up too early and then you'll cool back down before the court's available. So, from your recommendation, maybe 15 minutes ahead of playing?
Yeah. At least, get the heart rate up a little bit.
Yeah.
15 minutes, and then just stay moving.
Yeah.
It doesn't have to be anything extensive, but stay moving up to the time you go play.
And even just maybe doing a little light kind of walk around the courts a couple times, a gentle stretch while you're waiting for the court to open, and then maybe going to more of the functional specific dynamic warm-up once the court opens can be quite helpful.
Yeah.
And that'll significantly reduce the risks of injury. Do you play pickleball?
I've played a couple of times. Yeah.
Do you like it?
I do.
Yeah.
Yeah. I've played only outdoors over here.
Yeah.
I'm looking to get into one of those indoor courts still.
Yeah, I think it's a fun sport. I think it's nice because it's a sport that a lot of people can play. And so, we just wanted to do an episode regarding possible injury prevention, and or dynamic warm-ups to reduce the risk of injury regarding, pickleball. But I think this can be functional across all kind of athletic activities, tennis and any type of other sport that a lot of people are playing, even golf.
Yeah.
Maybe we'll do one for that. We play golf together.
Yeah.
Golf.
So dynamic warm-up correlates to everything.
Yeah. I park the car and I step onto the first tee. So again, I'm a terrible patient. Anything else? Anything you want to add that you think is important?
No, I think we covered it pretty good, but we'll go over that warm-up stuff.
So, as we talked about, if at any point you feel like you're having an injury that's exceeding kind of your level of tolerance, as Darin mentioned, kind of 6 out of 10 pain, maybe lasting more than 3 to 5 days, and you just want to get it checked out, I think the first stop is to go into the Express Care Clinic at Colorado Springs Orthopedic Group. Again, it's a walk-in clinic, open 9 to 5 during the weekdays and 8 to noon on Saturday. We can check you out. We can do x-rays. If we think there's a concern about a soft tissue injury, we can do an MRI on it if necessary. And if we think it's something that can be successful with physical therapy, we can do that. And then, as you said, it's not necessarily a huge commitment with the therapy. A lot of the times it's maybe 1 or 2 visits a couple weeks apart, just to kind of show them how to do the exercises and give them an at-home program. Thank you for joining us on this episode. This was a great conversation between myself and Darin, one of the physical therapists that works at the practice I work at. If you'd like to see Darin give a video demonstration regarding the pickleball exercises he recommends and the TheraBand exercise he recommends, you can see this on the YouTube page, Ortho on the Go YouTube page. He has a section in this discussion where he actually will give you examples of the exact exercise to do regarding pickleball injury prevention and strengthening exercises. Thank you again for joining us. We appreciate your time and listening to the episode. Please feel free to follow us on social media, both Instagram and Facebook. Please feel free to reach out or comment regarding episodes you like, what you didn't like, and possible ideas regarding episodes in the future. Thank you and have a good day.